Isometric exercise regimen. It is a type of static muscle contraction in which muscle develops tension without any visible joint movement or change in the muscle length. Example: quadriceps sitting exercise with knees straight. Principle of isometric exercises: no joint movement occur, muscle length remain constant, tension is developed against an immovable resistance, strength gains occur at specific joint angle trained. Breathing should be normal, avoid valsalva. Intensity as usually range from 40 to 80% of maximal voluntary contraction. Hold time generally 5 to 10 seconds per contraction. Adequate rest between repetition. Method and procedure. Position patient comfortably. Joint placed in desired angle. Therapist or object provide resistance. Patient instructed to tighten the muscle, don't move. Hold contraction for 5 to 10 seconds. Relax for equal or longer time. Repeat 6 to 10 times. Perform 2 to 3 sets per day depending on tolerance. Progression of isometric exercise. Increase hold time 5 to 10 to 50 seconds. Increase resistance. Increasing repetition. Train at multiple joint angles. Increasing frequency per day. Advantages: useful when joint movement is painful or restricted. Early strengthening after injury and surgery. Minimal equipment required. Improve neuromuscular activation. Safe for unstable joints. Prevent muscle atrophy. Disadvantages: strength gain limited to train angle. Poor carry over the functional movements. Can rise blood pressure. No cardiovascular benefits. Not ideal for late stage rehab alone. Indications: acute joint inflammation, post-operative immobilization, fracture stabilization phase, osteoarthritis, muscle inhibition, early stroke rehabilitation, patellofemoral pain, ligament injury. Precaution: avoid breath holding, monitor BP in cardiac or hypersensitive patient, avoid maximal effort initially, pain-free range only, avoid prolonged stable holds, careful in pregnancy and hernia. Example of isometric exercises: quadriceps sets, gluteal sets, hamstring sets, abdominal bracing, wall push-up hold, neck isometrics. BRIME, brief resisted isometric exercise, an isometric strengthening technique in which brief repeated maximal or near maximal isometric contraction are performed against resistance to increase muscle strength. Principle of BRIME: very short duration contraction 5 to 6 seconds, high intensity effort, static muscle work, resistance is manual or mechanical, rest periods between contraction, emphasize on correct breathing, train muscle at a specific joint angle, usually performance set. Method and procedure: patient positioned properly, joint fixed at a training angle, therapist applies resistance, patient asked to push as hard as possible, don't move, hold for 5 to 6 seconds, relax for 10 to 15 seconds, repeat 6 to 10 times, perform 3 to 2 sets. Progression in BRIME: increase resistance, increase repetition, add more sets, train at a different joint angle, reduce rest gradually, increase contraction intensity. Advantages: rapid strength gains, useful when range of motion is limited, requires little equipment, time efficient, help neural recruitment. Disadvantages: sudden blood pressure rise, risk, angle specific strengthening, not for cardiac patients, can cause fatigue, requires supervision. Indication: early strengthening phase, post immobilization, joint pain, limited motion, muscle weakness, tendon healing phase, neurological inhibition. Precaution: screen on hypertension, heart disease, avoid breath holding, start submaximal monitor pain, avoid in acute inflammation, therapist must stabilize joint.